Welcome. Welcome to the Healthy Start family. Listening this evening, I would like to hope that I'm going to inspire you, I'm going to motivate you, and certainly give you a more than small peek into the open window of what we can do to help the silent crisis that's troubling our children in our country. Because it is something, it's reaching epidemic proportions, but it's sort of laying out there in the weeds, and not a lot of people are paying as much attention. You'll hear snippets of it on the news, in the literature. You'll see some things maybe on Facebook or any of the other social media aspects that we use. But I'm trying to bring it out there to you this evening. I want to get myself involved with you, the listener, to try to understand this silent crisis is something that impacts almost everyone who has a child, grandchild, nephew, niece, friend, or anything else like that. You can see at the bottom of this particular slide that this issue actually has an impact on 9 out of every 10 children. When I have a consultation in my office, when I have kids come in to evaluate, it has gotten to the point where it's rare to find a child who doesn't have some of these problems. Now, let's kind of look at the list of this. We don't need to go down the entire thing, but I think we can point out certain issues that come into play here. You know, restless sleep, mouth breathing and snoring, maybe the dreaded ADHD, ADD, maybe bedwetting, aggressive behavior, allergies. And as you're reading this, maybe you're beginning to think, I know we're early in the discussion, but what I'm hoping you're looking at this going, oh my gosh, I can't believe it. 3 out of 4 of my kids have some of these problems, or both of my grandchildren have these problems. And what I sort of try to hope people will realize, these things are not normal. Children should not have these problems. But the beauty of it is, the Healthy Start system is there to help. We are the cavalry coming over the hill, okay? We want to be there to help you with your child and or grandchild and or niece and nephew, to help make an impact that's going to be so far reaching that it will change your life as well as changing the lives of your children. So the research that we've had over the past 20 years, each of these conditions that I've mentioned, let me go back, each of these things you see listed, and there are actually many more. These are just a brief listing of what we've got. But without question, these things are related to sleep disordered breathing, SDB. Maybe you've heard of it. Maybe you haven't. One of the things you can do as a parent to try to get an understanding of, does my child have an issue? Is there a problem? Are they suffering in any way? What I always tell the parents in my practice, I just say, look, here's what I'd like you to do. Have your child go to bed. Now, again, we're talking about children ages 3 to 12 or 2 to 12, somewhere in that. That's kind of our wheelhouse for treatment, shall I call it. In any event, what I want you to do, have your child go to bed, put to sleep, brush their teeth, read a book, whatever you do at nighttime, your routine. Go downstairs or into the living room for a while, and then about 30 minutes later, go back into the room. Wait for them to be nice and, completely asleep. Quietly walk in and then just sit down for a moment, 3 to 4 minutes maybe. And I want you to look for 3 different things. 1, are they grinding their teeth? 2, are they snoring? 3, are they breathing through their mouth? That's the big 3 for me. And one of the reasons I like those 3 is they're all easily identifiable. If one of those 3 conditions or more is occurring with your child, they are suffering from sleep disordered breathing. And that's not a good thing. For the longest time, as Kathy mentioned, for me, been practicing since 1979. Actually, July 16th, just this week, was my 38th anniversary of practicing dentistry. A wonderful profession, a wonderful career. I've loved it. Wanted to be a dentist since I was a little boy. So for me, how shall we say, I'm living the dream. Anyway, it's been something that I wish I knew Healthy Start 38 years ago. My own son, my wife and I's son, he was grinding his teeth all the time. He suffered with bedwetting episodes. Boy, I wish I would have known something then, but I didn't. So I did the best I could like everybody else. But I can remember so many times telling parents over the years, hey, you know, Megan grinds her teeth, Jimmy grinds his teeth. And I would just say, you know, that happens. Don't worry, they'll grow out of it. Oh, that was just the worst thing I could have said, but I didn't know. I just didn't know. Not only will they not grow out of it, there's a possibility they may grow into some form of sleep apnea. So these issues with sleep disordered breathing, we need to find out about what causes them, what are these conditions, what are the causes, can we help? Now, let's say, in fact, you've identified these problems, one of these problems, and you say, okay, I'm off to the pediatrician. I'm off to the children's psychologist. I'm off to the pediatric neurologist, whomever it may be. Here are the things that are going to come into play to try and help you, okay? Drugs, allergy testing, tutoring, special ed, counseling, therapy, maybe surgery. You can see that all of these things together, though, think about this now. Are they really treating the cause? Or in fact, are they basically just looking at the symptoms? Because in fact, most of the people that you do talk to do not have a solution. Okay? They only treat the symptoms. I kind of call it's like a little Band-Aid, and it doesn't even have any adhesive on it. It's not going to work. And it's as a testimony, the fact of any of you out there who've used any of these techniques via your pediatrician, you know it's not working. There are short-term solutions. There's all kinds of side effects. Not to mention, from an investment standpoint, you never know what that's going to be. Sometimes these things are painful. And most of all, as it says right here, ineffective. They don't work. Okay? Anytime anybody out there, think about it. If you're trying to solve a problem, don't you want to try to latch on to the cause or reason behind that problem and then follow a sort of series of logical steps to solve it? But if you're not familiar with how to do that, then basically you'll pop a little Band-Aid on and, see what happens. Maybe it'll work, maybe it won't. It's unfortunate, really, really unfortunate that basically our healthcare system that we have, citing the many professionals that I just spoke of, really don't address these problems and don't deal with them at the root level, down at the cause, down at the reason. Why are these sleep disordered breathing issues happening to our children? But here's the cool thing. Dentistry can help. We have the knowledge, we have the tools, we have the expertise. I just finished last weekend teaching a course in Orlando. I'm teaching another course this weekend in Charleston. What am I doing? I'm grabbing hold of the doctors in our area and that come to these seminars, and I'm trying to give them the knowledge and training that I know and can help them help you and your children. So as dentists, we have this knowledge. We can actually impact this situation by solving some of these problems. The dental community no longer deals with just teeth. When I teach the course, I always say to my fellow clinicians, I say, today we're actually oral physicians. We've stepped out of being a dentist. The realm of treatment that we deliver is so far-reaching that I think we are oral physicians. And this particular program, the HealthyStart program, proves that even more so than others, because we're right in the middle of understanding how we can help these kids get healthy and stay healthy, how we can latch on to how that child will be in the future. I always like to say this to parents. I really, really want to help, because what I'd like to do is I'd like to create an even better version of your already wonderful child. It's all about help. That's why we do what we do, right? It's all about help. Now, when we look at these two pictures, we think to ourselves, are these healthy children? Now, I think everybody would look and at least in their heart just sort of say, wow, kids don't look too happy, do they? They look kind of sad, and you see this young guy and he's got these dark circles under his eyes like, oh boy, I haven't slept in weeks or months. And you have this young lady, she's a pretty girl, but gee, she just looks so sullen and unhappy. And she even has also a little bit of dark circles under her eyes. I don't think these kids are healthy. And I think one of the problems is we see these children, we see these kinds of portrait photos, and we day to day in our lives, we see these children, and we have begun to just think that that's the normal way they should look. That's just not good, okay? These kids are not healthy. Are these two young ladies healthy? I think what we're trying to point out here, though, is that it may be not so easy to tell as these two, where you think to yourself, wow, yeah, they really look like they could use some sleep. I mean, they just look really beat. Well, these two young ladies don't necessarily have that appearance, but what they do have is what I would consider to be a lower jaw that is pushed back and has never been given the opportunity to grow normally down and forward as a lower jaw should. So what I'd like you to do, just for a second, I want you to pretend there's a little point here, a point here, and a point here. Now, when you go forehead to nose to chin, it should not be such a dramatic curve. The tip of that chin should be out here somewhere. That's a full, in the picture anyway, that's a full 5 or 6 millimeters of difference. Likewise, when you come to this pretty young lady, we go tip of the forehead, nose, and chin. I think you can all appreciate that it presents a severe curve. And that severe curve is an indication that the lower jaw has not developed properly. Now, you're saying to yourself, okay, Dr. D, what's that have to do with anything regarding sleep disordered breathing? This doesn't even make sense. It doesn't even seem applicable. Yes, you're right. The children don't look, their jaws aren't developed properly, but what's that have to do with anything? It has a lot to do with everything, because the lack of proper development of the lower jaw turns out to cause a restriction in the airway, and therefore reduces the valuable amount of oxygen that should be present when children are sleeping. And I'll show you some pictures in a few minutes where I can even accentuate that further by taking these same children and picture them sleeping with their mouth open. And I'll show you what that will look like. Now, when we want to get back to, we said that we have the tools, we have the knowledge, we have the ability and the training to treat the actual cause of these problems. We say to ourselves, okay, what are these causes? What are some of the things that are going on? All right, first of all, mouth breathing. Remember I said my big three: clenching, snoring, mouth breathing. Mouth breathing allows the lower jaw and your tongue to lie backward in the mouth and push toward the back of where the windpipe is, and can cause a reduced airway. If you suck your thumb and or your fingers, what you're going to do is cause, if you're really a little person, you're going to push the palate. The roof of your mouth is actually going to be pushed up higher, causing a bit of a close off of the airway where the air comes through your nose, and it's also going to force your chin back and your tongue back. Now, these things are all adding to improper air circulation, improper breathing. You get an upper arch constriction or a high palate, which definitely has an effect on it. Now, one of the key points to sleep disordered breathing and its causes of all the issues we talked about back on slide number 1 have to do with the fact that if you're not breathing properly, you don't go through the proper sleep cycles. And when you do that, particularly evident is my next to the last bullet point of reducing REM sleep. Oh my gosh, REM sleep. Can't tell you how critical this is. It's critical for everybody, for all of us. Everybody listening out there, you need some REM sleep. There's no question about it, because it is the most reparative stage of sleep that you can go through. But think about it for a second. If you're an adult and your systems are kind of already developed, sure, you'd like to have a good night's sleep with all the cycles, but spin that back to a 5-year-old. The development of all of the systems of their body, so critical. The highest rate and speed of development occurs during REM sleep. So doesn't that go 1 + 1 = 2? If you're not getting the REM sleep you're supposed to, guess what happens to all the developmental systems? They don't work. They don't go like they're supposed to. And look at that last one. Sometimes this causes multiple behavior, social, and body health symptoms. Something I find always interesting when the kids come to my office for a consultation, when they come in, we always have a little thing in our staff. We always try to guess how old the child is before we actually talk to them. And you know that we never get it right. We always think the child is younger than they are. Had a little girl the other day, I thought for sure she was 6, maybe 6.5. She was 9. Now, I'm not saying that that does every time, that it's always applicable, but I can tell you, because these developmental systems are slowed, they're not allowed to progress as they should, you'll see things like that. Short of stature, social behavior is very, they appear somewhat remote, shall I say, or they're introverted. They may suffer from other issues with behavior that sort of link themselves to other traits like ADD, ADHD. I'll talk about that in a second. But you'll see other things that come into play because of this sleep disordered breathing. Now, when a child develops, we want to use this term craniofacial growth. Now, that sounds like a, kind of a big word. And what it really means is just your head and your face. How does your head develop and how does your face develop with it? Well, not important to trace all these lines, but what's important at age 2, if you kind of pretend you're this line, by the time you're 17, you're out here. Now, one thing I want to look at is take a look at the chin when you're 2 here, and take a look at it here. What we find that about 55% of 2-year-olds, that whole head and face thing is developed about 55% of the way. At age 4, it's developed approximately 75% of the way. At age 12, it's up near 90, 93% for both boys and girls. So how that's a critical point is if some habit is occurring, or some, shall I say, dysfunction, something not working correctly, does not allow the lower jaw to grow down and forward, you'll see how that airway can be constricted or restricted. You must have this kind of growth to have proper development, to therefore have proper sleep, to have proper sleep cycles, to have REM, to have everything else you need to be. How come our kids are not like that? How come we see these kids that look sleepy and tired? How come we see them with the lower jaw pushed back? What are some of the factors? Well, the wonderful Dr. Robert Comuccini, he did some studies a little while back that talked about what are we eating and what impact might that have on the development of the jaw, the placement and position of the teeth, and then how that might relate to airway. So he's kind of saying that unless we choose some stuff that's got some tough stuff to it, a little bit of consistency to it, if you don't do that, then you're going to get some irregular patterns of how your teeth come through, and you're also going to get vastly underdeveloped upper and lower jaws. This results in something we call in dentistry a malocclusion. All that means for you out there is that your teeth and your jaws don't fit together correctly. That's all it means. If you hear the word malocclusion, things aren't fitting and working correctly. And that happens when you have underdeveloped upper and lower jaw and improper tooth position. Now, in the so-called Western culture, in Europe and in the United States, these studies were done, and they kind of took a look at, is this something that passes down through generations? Is it something that we should be worried about? Should we say to ourselves, oh, okay, processed food, whatever. I think today all of us certainly, you see the evidence about how processed diet and people that are overweight and our epidemic of obesity and things that happen in our country. But I'm going to take you a step further tonight. I'm going to get you one more look into the processed food industry, the soft diet, and the huge input of sugar and things like that. What we find is we'll see in the first generation of the people who kind of use that diet as their mainstay, about 50% of those people suffer from some kind of malocclusion. All right, teeth and jaws don't fit right. We bump that to the second generation and keep those food and diet patterns. All of a sudden now we're up to 70. Oh my gosh. Now we go to the third generation and take a look at that statistic. 85% was some type of malocclusion. I can tell you right now, from my own experience, when I look at the kids in my office, it is incredibly rare to see a child who doesn't have some kind of malocclusion or some kind of problem where their teeth aren't jumbled up, the arches aren't rounded, their face is not developing properly, their lower jaw is depressed down and back, and they're not sleeping. Put that all together, sleep disordered breathing, we've got problems, okay? We've got problems. Now, I'm not saying that you hand your infant a carrot and have them start chewing on it. But I'll be doggone, if they've got a couple of teeth in there, nothing wrong with giving them something that's more firm than a melt away. some little processed food thing that as soon as it goes in your mouth, it disappears. It just dissolves instantly. That's not good. If you have some teeth, you can chew some things, okay? We get a little bit kind of, over paranoid about possibly choking. And, don't get me wrong now. I'm not trying to go down the road of having kids eat solid foods before they should. But I think we've jumped over a little bit to where we're so upset about or so concerned, anxiety ridden, that we're having children eat things that they really don't need. They need snacks that are healthy and that are firm and have some resistance so that when they chew, their jaws and teeth develop correctly. Another thing that comes into play here is the use of a pacifier. Now, I mean, we have 3 kids, I can remember the days when, they were little and the pacifier, it has its moments. You're trying to do things, the world around you is spinning and you have all 3 kids with you and 2 of them are screaming and you just say, here, put this in your mouth. I'm not going to sit here and make a big issue about that. But what I will say to you is that if you use a pacifier beyond 6 months of age, you are beginning to contribute to a malocclusion. You're beginning to contribute to improper arrangement of teeth, jaws, and everything else. Also, prolonged feeding with a bottle is also not so good for kids. You've got to be careful that you don't go beyond about 6 to 8 months because that begins to promote improper development. Now, when I see a child, what I like to see, I say to parents, I want the picket fence look. Spaces, 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 everywhere I look. Every single tooth has a space. Now, that's not something that's rocket science. Think about it for a second. Let's talk about this tooth right here, all right? That big old front tooth right there. These are baby teeth. Now, this tooth probably measures about 6 millimeters in width. The new adult tooth is going to be 1.5 times the size of that tooth. So I hope you're thinking, if in fact these teeth are perfectly straight with no spaces, well, what's going to happen? When the teeth come in, boom, crowded. Without question, they're going to be crowded. So I'd like to see spaces. Don't see it very often, but I'd like to see spaces. That would be the perfect deal. A few minutes ago, I chatted with you a little bit about the airway. It may be a good idea right now just to look at what I call a cross-sectional diagram of someone's head. And in that cross-sectional diagram, we can identify some of the things that are pertinent to our discussion tonight. First of all, you have where the teeth sit together right here. You have the big old tongue. And let me tell you, the tongue is the most important orthodontic instrument known to man. That rascal will move teeth and separate jaws and do all kinds of stuff if you don't train it properly to do what it's supposed to do. Okay, here's the nose. You breathe through your nose, and your air goes through these things called turbinates, and then it fires on down the airway, okay? Epiglottis, it closes off the airway when you swallow so that food doesn't go down the airway. But you see a relatively wide airspace here for air to move correctly through there. And that's what we'd like to see. Sometimes we look at the development of the upper jaw as well. And our studies are showing us that, in fact, if you have proper expansion or proper width of both the upper and lower jaw, that will help correct sleep disordered breathing issues. That we do find that many times children and adults, for that matter, when I see adults whose arches are so crowded, and what do I mean by that? The distance from here to here, the distance from here to here. This skeleton, or this picture that we're looking at, has very rounded, well-proportioned upper and lower jaw. Many times when I look at kids and adults, they often have V-shaped arches. Just think of them being constricted, almost like you put your thumb in your mouth and you sucked as hard as you could and it pulled all your teeth together, okay? Sleep disordered breathing is directly related to that jaw constriction. And if we can deliver some type of treatment that will help that, it'll be major league improvement. Okay, I talked to you and I told you I'd have some pictures for you. All right, here's an airway in a normal developing child. Look at the distance between here to here, okay? We have the tip of the forehead, nose, chin, okay? As this child develops, we want this chin to come down and forward. Think about that for a second. As this lower component grows forward, What do you think might happen back here? I hope you're thinking, yes, this airway will actually even get a little bigger. How cool is that? Now, let's in fact take a situation where the lower jaw has been pushed back or not developed properly. And now look at the airway on this one. Oh my heavens. Wouldn't you say this is like a garden hose? That's like a coffee straw. Sometimes when I have the kids come in, I'll actually have mom or dad who's ever with say, here, take this coffee straw, suck in as much air as you possibly can. Well, you can't. You put it in your mouth and it's like, you just can't breathe. And I think, imagine that's a big giant straw that's inch and a half in diameter. Boy, the air is going to flow through there like you wouldn't believe. So if we go back again, here we have lower jaw, good positioning, nice airway. Lower jaw retruded back, airway constricted. Now in our photograph, nice. There we go. Tip of the nose here, tip of the chin here, not back here. So what do we have is a normal jaw developed down and forward. Here we have a lower jaw, never had the opportunity to develop properly, whether that was from a habit of some sort or processed food, eating, the diet, the different things like that. This lower jaw, in fact, is not forward, it's tucked back. So with that being tucked back, what do you think's going on with the airway? You got it, it's restricted. Now, remember I mentioned my big three. When you go in to notice your child or grandchild sleeping, grinding teeth, snoring, mouth breathing. None of these things are acceptable, folks. None of them, okay? If you see them, I need you to get in touch with your one of your dentists in the area that's a provider. And you can go on the HealthyStart.com and punch in your zip code and you'll find a provider in your area. In any event, this little girl sleeping in the car, tilted back, mouth wide open. If we had her head tilted to profile version, we could see that her lower jaw is quite retruded. And if it is, that's going to cause a restriction in her airway. I can illustrate that even better with this little video.
Listen to this mother describe her baby's sleep disorder breathing. There you go. Now watch what happens when she's able to open the airway by simply shifting the position of his jaw. Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. Airway. Just bring his airway forward.
That's perfect evidence of what I was trying to illustrate regarding why mouth breathing is such a negative situation, and it is a root cause of sleep disordered breathing. You notice how quickly, when his lower jaw was pulled forward, it opened the airway. Suddenly his noisy, snoring, kind of irregular breathing pattern immediately was dissipated and there was quiet all around. Okay? So that you need to really keep that in focus and in your memory. Here we go with the coffee straw. We don't want kids breathing through that. We want them breathing through a big old garden hose. So let's try to put the whole thing together. Sort of created kind of a little flow chart for you here. Hopefully this will help explain the prior discussion and the lead up to this point. So what we have up here is we have maybe some extended bottle feeding and pacifier use. You have a soft diet processed food, sucking the thumbs, fingers, pencils, whatever the case may be. All these things together contribute to underdeveloped arches and jaws remaining. The arch itself, when I say underdeveloped or improperly developed, instead of being a beautiful, round, open curve, it's almost V-shaped. So now you take this particular development that's occurred in the child and you swing it forward, because now we know this is going to compromise their airway. What does it mean by compromise? It means it restricts it. It takes it from a garden hose to a coffee straw. Well, when that occurs, then you have the following things happen: mouth breathing, snoring. If you don't breathe through your nose, you often, when breathing through your mouth, will cause swollen adenoids and tonsils. Think about that for a second. If the tonsils puff up and you're trying to breathe through your mouth because you're not breathing through your nose, the puffed up tonsils close the airway even further. So that even causes more trouble. You have the improper position of your tongue. Arches are not right. You have a malocclusion. Remember that word I used earlier, malocclusion. Then you intern will often find that you'll have an overjet or an open bite. Now, okay, what does that mean? What does that mean? All right, an overjet would mean that the upper teeth are sticking out over the bottom teeth a considerable distance. Overjet, okay? Open bite means that when the child closes their mouth together, their front teeth never contact. That open bite can be anywhere from 1/8 of an inch to 2 inches. Can be very severe. Then you couple that with having maybe something called a crossbite, where their teeth, instead of overlapping properly, they're crossed over. They're not hitting correctly. Now, so you took this problem up here, the cause of the issues, then causes a compromised airway, then leads to sleep disordered breathing. What does SDB lead to? I showed you right at the top of the show tonight. All these symptoms come into play. All these symptoms come into play. Here's the beauty of it. HealthyStart. We can fix it. I help these kids every day in my office, and I see results every day. Results that would bring you to tears, honestly. Mom's calling me, telling me that their child no longer wets the bed. Mom's telling me that their children do better in school. Telling me that they wake up in the morning, the kids are raring to go. Just time and time and time again. We in the dental profession can fix it. Here's how. We use HealthyStart. Now, this particular system, Kathy mentioned to you right at this top that Dr. Bergerson, has invented all these amazing appliances. It's like different styles and types of oral mouth guards that will help these symptoms, treat the root cause of these problems, alleviating all the symptoms that I've talked of. You can see that it's been going on all over the world. Now, here's the things it can do. By wearing this particular mouth guard, you will expand the arch. You will be able to help the person establish nasal breathing. That is so absolutely critical for proper development. Your nose and the filtration system that's associated with it takes all the crummy stuff that's in the air, you breathe in, and miraculously, it becomes perfectly pure and clear and healthy. But if you don't breathe through your nose, then all that air junk goes flying down the windpipe and gets in there and starts causing trouble. So you're going to have nasal breathing is the key. These appliances promote that. We will train the tongue to stay in the correct position so that when you swallow and you speak correctly and you swallow properly. It will eliminate all these habits. I can eliminate thumb sucking in usually a week. But what I do with that, see, is I don't tell the child or the parent that I'm going to eliminate thumb sucking or I'm going to eliminate the habit. I say to them, I'm going to replace that habit with another habit. And that will be to place the HealthyStart mouth guard in and use that to replace the thumb. But the cool thing is there's a method to my madness, okay? Because once you get the thumb out of there, then all of a sudden the HealthyStart mouth guard starts to promote proper position of tongue, lips, teeth, arches, growth, mandible, blah, blah, blah. All stuff ends up working out perfectly. Okay, when the HealthyStart program's in place, we can get that lower jaw to come down and forward, which will correct that issue I talked about with overjet. It opens the airway, also encourages proper growth, and you get an ideal overbite and overjet. All the teeth fit together, and it also ends up causing almost no relapse back into the positions of where the teeth were before. 97% chance of perfect dentition by the time the kids are 12 or 13. Many of these cases do not need orthodontics later. Let's just show you a few pictures of some kids and we'll just kind of buzz through these nice and easy. Here's a little guy, 9 years of age. I think all of you can identify. Let's do it. Forehead, nose, chin. Where's that chin? Wait a minute. Come on now. It should be out here, right? Not back there. Sometimes when the kids have a retruded chin like that, retruded lower jaw, they almost look kind of chubby. But this little guy's not chubby. It's just that his chin's pushed back. If he could breathe properly, his lower jaw would develop down and forward, much like it has here over the years of cooperating, or should I say being treated with HealthyStart. Here's the picture, the x-ray picture. Let's go back one. Now we look at Michael here. Then we go one more forward. Here he is before. And we notice that the airway is kind of pushed back. You'll see that his lower jaw is back here. Look how nice it's opening up. We see a nice big garden hose there, and everything's coming in there, and he's breathing better. And we know if he's breathing better, he's what? Sleeping better. That helps for development. The cool thing here, when we go through this program, All of our children that we treat, by the time they get to be 12 or 13, they kind of look like Michael over here. They don't need braces. That's pretty cool. Now, it's never a guarantee. I never say to my parents, absolutely guarantee this child won't need braces later in life. All I can do is quote Dr. Bergerson's statistics. Tons and tons of research showing that 93% of the kids don't need braces later in life. Here's another healthier Michael. He was a great young guy here, but this is just an even better version of him. Okay? Good guy, looks great, feels good. Here's a scenario here where the sleep disorder breathing issues were addressed, but we also ended up with this child having issues with their position of their teeth. So we had them go through the system, wearing the guards as directed, and here we go here, 12 months of treatment. Look how nice and round. Let's look closely at the width of the arch. Notice, if you go from here to here, and step across, and go from here to here. Holy smokes, that's like a 3 to 4 millimeter increase in width. This one back here, his tongue couldn't even fit in the space. Now it just sits in there nicely, works out beautifully for you. I mentioned earlier that there's sometimes a connection with ADD and ADHD that can possibly be attributed to sleep disordered breathing. And Dr. Karen Bonuck has been responsible for doing a ton of research on this. And her program and her research program enlisted 11,000 children, studied over 6 years, okay? And what are her results? We know that sleep disordered breathing increases the risk to these problems by at least 50%. Her study was published in 2012. Today, we're now using figures closer to 60%. I would tell you, as a parent and a clinician, if your child is currently being treated with ADD or ADHD, it is at least worth looking at the issue of sleep. Is this child sleeping properly? If you need help, go to your HealthyStart provider. They can do the job for you. Because if you go to the pediatrician, they're going to wave their hand in your face and say, no, 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 it's not a sleep problem. And that's really just the fault of the profession at large that isn't trained and doesn't want to listen to all this research that we have. Okay? I don't need to get on a soapbox about that. It's just important for me. My goal is to help as many kids as I possibly can in any way that I can. So therefore, if I can help any of those children taking medications and things like that, that maybe they don't need them, I would be thrilled if I could. Now, here's a huge, huge issue. This is something that is just amazing. You almost couldn't believe it. It almost seems counterintuitive. How could bedwetting be associated with not breathing correctly when you sleep? Well, you see, I talked about the REM sleep and how it has such a huge impact on things. It causes the development of the systems to all what I call marry together. The endocrine system, the hormone system, all these names for all these different things. But think about, a gajillion different things in your body that are trying to develop and grow and kind of just marry all together into a beautiful person. All these different systems, you must have that REM sleep. If you don't, they won't all pull together and do the right thing. Okay, for us, we wake up in the morning, our feet hit the floor. What's the first thing we do? We go to the bathroom. Our body just goes, red alert, you need to get to the bathroom. Boom, there we go. For the kids, if they're not doing the REM sleep thing properly, all those systems don't work properly. They oftentimes go into a deep cycle of sleep called delta, and they don't know that their bladders are going to empty. But you'd be absolutely amazed at how much success we have treating children who have bedwetting issues. Just the other day, I got an unbelievable phone call from a mom who their son is 10 years old. I put him into the HealthyStart program with the first phase of the mouth guard to wear, and 2.5 weeks later, she called me, and I thought she was just going to come through the phone and hug me. For the first time in the child's life, he woke up dry. He was so excited. He just looked at mom and he just said, "Does this mean that it'll work forever?" No, it was just, man, it just about brought me to tears, Anyway, bedwetting is a huge problem, and it can be solved with HealthyStart. Here's some other case studies to kind of go through for you, just to show you some things. Here we have a 5-year-old with what do we think about that lower jaw? Not in the right place, right? Treated properly with HealthyStart, lower jaw down and forward. Now we see a very nice profile. And here we see it age 5, or 5 years later rather, and then post-retention at age 12. Look how pretty her teeth look. That's a gorgeous case right there. Here's another guy who's 12, between he's 12 and 14. Now, I don't think his issue is so much of lower jaw growth, but he was a mouth breather, and he also snored. And so we just needed to get in there and correct the position of his tongue and try to get his arches widened out a little bit. Now, I will say this to you, and this is really important too. The Healthy Start program centers itself around the issue of growth and development. You take growth and development, couple it with the Healthy Start appliances, and it is a slam dunk, home run, kick the field goal, you win the game kind of a deal. All right? Now, the later you catch these kids in life, the system still works, but it may require more time and more commitment on the part of the child. You like to be able to capture these issues when the kids are little, because then as they're growing and developing, you can just walk along with the Healthy Start appliances and get the perfect results. But either way, by widening the jaws and getting the teeth set better, we did a really nice job here for this patient, and everything came out really well. Here's your young guy, 8-year-old, kind of having a funny look at the camera. And I will say this, in this 6 years of time, he certainly changed his hairstyle, didn't he? He went from here to here. But we look at his teeth, very typical scenario where he has a wide gap between his teeth. They're flared out. His jaws are constricted. And now look at the space that he has, and his teeth have come into position properly. It's a really, really great system. It's a system that will help so many children. It's just unbelievable. What I'd like to do now is just show you a little bit of an example of one of my fellow clinicians who talked to you a little bit about how Healthy Start impacts her patients in her life.
It unlocks their potential. I mean, if your kid is suffering, they can't breathe, and it's scientific, they can't get oxygen to their brain, I know that parents want to do whatever they can to help their kid be the best, grow the best they can. And in this society, we do so many things geared towards that, and sometimes we think it's the best, and it may be from drug perspective, or like we're doing it because we think it's the best for your child. But and Healthy Start gives us a natural way to do this for our child and not plug them with chemicals and just deal with their own like way of growing and just helping them grow, which, you know what, can make them smarter, make them not act out as much, and can make them prettier. If you have everything in the right place, you are a better looking boy or girl. So, which builds confidence, and there's just so much to go with that that can set you up for success 20, 30, 40, 50 years down the road. And if a parent can do that from a piece of plastic, awesome.
I think that Dr. Stam points out something that came into play for me this past weekend when I was teaching in Orlando. After the course, I went down to the restaurant and sat down and had a sandwich, and a fellow sat down beside me, and conversation started, and it turned out his son, 8 years of age, wet the bed, grind his teeth, snores all night, doesn't do well in school, isn't a very good athlete, all these things together. And I sat there and just chatted with him for a long time. And he finally looked at me and he said, it's my obligation as a parent to try to help my son be better about what he does in life and be more successful. So I'm going to get this program underway as soon as I get home.